There is consensus to move behind country priorities, to increase the amount of sustainable investment in countries so that we can have enduring health systems. The problem is that with so many reform efforts happening, there's also a very real risk of fragmentation, where they're not talking to each other, so that the country experience is to try to meet all of these different requirements and these different needs in a way that is actually just rebuilding a broken architecture of the past. We also have seen a massive push for domestic resource mobilization, but without really the details of how that's going to happen. And finally, and perhaps most concerning, we really found that the majority of these efforts aren't focusing on capacity. If we don't have the capacity for these countries or within these countries to be able to sustain the kind of reforms we're making, then there is going to be a disconnect between ambition and reality. We need them to come together and to start to build on their areas of consensus and find areas where there's gaps and begin to figure out who does what, who leads where, and how to come together behind these priorities in a real and actual way for delivery.